Polycystic ovarian syndrome is a significant health concern among women, affecting their reproductive health and overall well-being. Hello and welcome to Healthy Living on Trust Television. I am Aisha, Salihu. Now, PCOS, otherwise known as Polycystic Ovarian Syndrome, affects approximately 5% to 10% of women of reproductive age globally. But in Nigeria, local studies report rates between 13.8% and 18.1% among women in their reproductive year. Joining us today to help us grasp a detailed understanding of what PCOS is, its treatment options and lifestyle adoption is Dr. Henry Uwandu, who is a medical doctor. Thank you so much for joining us on the program, Dr. Henry.
Yeah, thank you very much. Thank you for having me.
PCOS is a significant health concern among women in Nigeria. It also affects 1 in 6 infertile women in Nigeria. Despite this, it seems the level of awareness of PCOS seems really low. But starting off, what would you say PCOS is, and kindly educate us about, the nitty-gritty about it.
Okay, yeah, thank you once again for having me. I want to start by saying that PCOS, otherwise known as Polycystic Ovarian Syndrome, is the commonest endocrine abnormality among reproductive age women worldwide. Is the commonest endocrine abnormality affecting women within reproductive age group worldwide. Yes. And this condition is characterized by 3 major factors. The first one is abnormal menses or irregular menses. Second one is signs of hyperandrogenesis, that is excess male hormones in these women. And then the third part is polycystic ovaries. Now, it is a problem that is completely not well publicized, in the sense that women that suffer from this problem usually suffer in silence. And that's the reason why we call it a silent oppressive disorder. Because women who suffer from this condition actually suffer in silence and die without receiving the treatment or the help that they deserve. Okay? This is seen everywhere around us, just like you mentioned. The statistics has it all, that it affects 1 in 6 women in our local environment. And this is a very serious issue, because in our environment particularly, it is one of the leading causes of infertility. And you know how fertility issues are taken, especially in the African setting. Now, the cause generally is not known. Up till today, scientists have not been able to find out the main reason why this condition occurs in some women and does not occur in others. However, some risk factors have been identified. One of them is genetic risk factor. It is known to run in families. In about 35 to 40% of cases, you will always hear a family history of a mother or an auntie who has a similar condition in an environment. So if there is a family history of this condition, the chances of a woman having it is higher compared to the general public. Other ones are genetic abnormalities that are inherited in different forms. But all this put together, like I said, does not usually show a definitive pattern that we can articulate and say that this is why this happened, and why this is the reason why it does not happen in another person. However, when you combine all the risk factors, family history, genetic inherited factors, as well as other environmental factors such as lifestyle, we understand, eating habits, and all other factors that may not enumerate because of time, all put together actually increases the risk of the disease. But remember, the exact cause is unknown.
Doctor, you have stated quite a number of risk factors there, and then you did make an allusion to the fact that this disease is not known. There's not much awareness about it. It makes room for people not to attack it when they should. But then I'd like to know, what then would you suggest or say are the common signs and symptoms of PCOS?
Okay, yeah. The PCOS is a complex disease that has also that have different forms of manifestation, in the sense that the manifestations can be both immediate and late manifestations.
Okay.
The common manifestations in our environment are things like irregular menses, inability to conceive, okay, and obesity, weight gain, that is overweight and obesity. And others include things like recurrent miscarriages and premature delivery. And we have other metabolic side effects, which include things like dyslipidemia, atherosclerosis, coronary heart disease, even type 2 diabetes and gestational diabetes has been associated with this. So it has both immediate complications or immediate presentations and late form of presentations, of which the commonest one around us is irregular menses, inability to conceive, as well as things that are associated with hyperandrogenesis, such as acne and excessive hair growth in women, especially in the pattern that are seen in men, otherwise known as hirsutism.
Doctor, we know that untreated PCOS can have several long-term effects on a woman's health. I'd like to know what then are the, some of the key considerations in this regard.
Yes, exactly. The long-term complications, the long-term effects are just, I've mentioned so many of them, but just to reemphasize, the first one is this chronic anovulation. Okay, chronic anovulation in women with PCOS can lead to a lot of other conditions, such as endometrial hyperplasia and endometrial cancer. What that means is that because these women do not have regular menses, just like every other lady, okay, there is excessive overgrowth of the endometrial lining, the inner lining of the womb, and as a result of unopposed estrogen stimulation, that is exposure to high level of estrogen. And every normal reproductive woman usually sheds the inner lining of their womb once every month in a condition we call a menstrual cycle. Okay, but when this menses fails to occur, there is excessive unopposed growth of this inner lining, and one of the things that can happen is that it can become abnormal or undergo malignant transformation and become cancerous, giving rise to a condition called endometrial cancer. Then the other ones are the ones that have to do with the metabolic side effects. Because of the hyperinsulinemia in this person and insulin resistance that occur in women that have PCOS, they are at risk of developing metabolic disorders. And metabolic disorders include things like type 2 diabetes mellitus, hypertension, obesity, atherosclerosis, coronary heart disease, stroke, and so on and so forth. Okay, these are purely as a result of both increased insulin resistance, decreased insulin sensitivity, as well as increased in adipose tissue deposition in such patients. And the other forms of complications that you can also see in these women are the mental health disorders, such as anxiety disorders, personality disorders, social isolation and discrimination, and all other forms of mental health disorders that occur in these women, especially because this condition is associated with infertility. And you know how fertility is held in high esteem in our environment. So women who have this condition, who cannot conceive, are seen as social outcasts. Some of them are referred to as barren. And that leads to a lot of discrimination and stigmatization, as well as other mental health conditions that these women have to contribute.
Doctor, you stated earlier the role of genetics in PCOS, and then you have also stated some risk factors. I'd like to know, I'm pointing out one particular thing, which is the excessive hair growth that we get to see on women who are suffering from PCOS, on the face or maybe probably other parts of their body. I'd like to know, what role does it particularly play in PCOS? I mean, at what point do we say, okay, this woman who has perhaps a few strands of hair on her face actually has PCOS, or this other one who has a full-blown maybe beard or something coming out from her face, then you can now tell this is PCOS?
Yes. Okay, thank you for that question. Now, excessive hair growth in women, especially in a pattern, that in a distribution that is seen in men, is called hirsutism. Okay, and then different causes of hirsutism. Some can be familiar, some can be idiopathic, but PCOS, most women that have PCOS are usually also have associated autism. Yes, also have excessive hair growth, especially in male pattern of distribution, such as sideburns, monsters, as well as the mustache seen in men. Now, when that occur, or when a woman has such problem, it is expected that the person should go for routine check with the healthcare provider to find out whether there is any other associated hormonal abnormality that may also be going on in that woman's body. Okay, because so many PCOS women have been identified just purely, mainly as a result of evaluation for autism. Okay. When when such is the case, then the treatment that should be given to the woman, which include the treatment of the excess hair growth in the body, will now be given to the woman. And then that will also help to initiate all other treatment that the woman needs, as a comprehensive treatment package for polycystic ovarian syndrome, including the infertility and other long-term metabolic effects I mentioned before, which are even the more life-threatening ones, such as hypertension, type 2 diabetes, atherosclerosis, and other coronary diseases.
Doctor, I'd like to know, we're still looking at awareness of polycystic ovarian syndrome, and among Nigerian women, it remains a critical concern. Despite its prevalence, many still lack knowledge about this condition. Estimates suggest that 1 in every 10 women of reproductive age grapples with PCOS in Nigeria. However, we have cultural factors, limited healthcare access, and societal stigmas that contribute to delayed diagnosis and management. I'd like to know, why do you think PCOS awareness is still very much inadequate in Nigeria?
In fact, I think that is one of the major problems in this condition. And that's why we regard it as a silent oppressive disorder, SOD. It silently oppresses women. And a lot of them, end up with morbidities and mortalities that should have been prevented if the awareness is there. So awareness of PCOS is highly reduced in the society. In fact, a lot of people don't even know. Go out in the street and ask women at random what is PCOS. You'll be surprised at what you will see. You understand? So the awareness is very low. And this is not far-fetched. This is as a result of, low awareness about the medical condition itself, okay? Lack of medical facilities where these women can receive treatment, okay? Lack of trained personnel on this particular condition who can actually give women the help that they need. And then, of course, the general condition that exists in our environment, such as illiteracy, poverty, women's subjugation, and all other forms of subjugations and women disempowerment that occur in our environment, all contribute to this particular scenario. So these are some of the reasons why this disease is still underdiagnosed. And I have to also tell you at this point that even for the women that are detected, you understand, it takes a long time for the diagnosis to be made. And even when diagnosis is made, a lot of women still have undergo a lot of time before they can get the treatment that they deserve. So there's no doubt that it is purely, the awareness is very low, and there's delay in the diagnosis and treatment. And as a result, women suffer the consequences.
I like the fact that you touched on the fact that it takes a long time before, diagnosis is made. I was actually going to ask about PCOS diagnosis and the constraints that women face. But I'd like to know, how do you think we can address resource constraints in diagnosing PCOS?
Yes, the first one is health advocacy, okay? Health advocacy should be increased, especially with regards to this sickness, knowing fully well that it's one of the conditions that is very common. We say is the commonest endocrine or hormonal abnormality in women, okay? And it is responsible for most cases of inability to conceive, which is a very big problem in our environment. So awareness should be raised. Advocacy, health advocacy on the importance of government participation as well as other stakeholders' participation in creating awareness, in creating funds and resources, in establishing health institutions, and also training medical personnel on the management of this condition. I think all that will go a long way, you understand. But most importantly, government participation. Lack of health facilities and trained personnel in this particular condition is one of the major reasons why there is delay in diagnosis. Because some of these women also go to the hospital complaining about irregular menses, lack of menses, inability to conceive, hirsutism, and other medical conditions I mentioned, like hypertension, diabetes, and all that. If medical personnel have this high index of suspicion and also are trained on how to detect these women early, I think it will go a long way to reduce the amount of morbidity that is associated with this condition. So all that has to play together with awareness creation.
Indeed, early diagnosis is key, and also much more awareness creation. Now, this now brings me to the point of treatment. You know, we can't just talk about risk factors, symptoms, possible signs without addressing the treatment options available. What then are these options available?
Yes. Okay, so the treatment, okay, first of all, let me start by saying that PCOS has no cure. So when a woman has PCOS, she must understand that there is no cure and that this disease has an immediate complication, that is immediate risk factors, as well as long-term effects that the woman faces, you know, until she dies. So the treatment is for life. Now, the treatment depends on what the woman wants or what the stage at which the woman is presenting. Okay, so the treatment is tailored according to the need of each woman. For instance, for women, for girls, for ladies that come as a result of irregular menses, our major aim of treatment at this point, since there is no cure to this problem, is to establish regular menses. For those that come as a result of infertility, the emphasis in the treatment for these women will be aimed at helping them to conceive and have a normal pregnancy and delivery without a complication. And then for those that present with metabolic syndromes such as obesity, coronary heart disease, hypertension, diabetes, and all that, the aim will also be to manage those conditions to reduce their complications. So for irregular menses, we can use things like combined oral contraceptive pills to regularize women's menses. Okay, before I continue with the medication, I want to mention that lifestyle modification is key. Yes, lifestyle, because it has been seen that if a woman can lose up to 5 to 10% of her weight at the time of diagnosis, her menses can actually return and can be regularized. Yes, for those that have amenorrhea, which is lack of menses, the menses can come back and it can become regular just by weight loss. Okay, so which means that regular exercises, okay, and then weight monitoring, diet restriction, and the avoidance of bad lifestyle habits such as smoking, drinking, and alcoholism will go a long way in actually ensuring that the woman, you know, achieves spontaneous return of her menses. So that's lifestyle modification there. Then the drugs can now include things like combined oral contraceptive pills we use to regularize their menses, and metformin, which are insulin sensitizers, that increases the sensitivity of the tissue to insulin, so that, you know, the hyperinsulinemia and hyperglycemia that occur in these women, which predisposes them to diabetes mellitus, is reduced. We also see that the use of these medications too can reduce high levels of androgen, which is the male hormone that is responsible for all the things I mentioned about, like hirsutism, lack of ovulation, and all that, and that can cause a spontaneous return of their menses. Then, for those that want fertility or that are interested in conception, we can use ovulation induction agents such as clomiphene citrate, letrozole, you understand, to induce ovulation, to make them to ovulate, and then with timed intercourse. That is timing the time of your planning their intercourse in such a way that it coincides with the time of the ovulation and increase the chances of conception. Okay. Then other drugs include things like GnRH analogs and surgical methods. Surgical methods we call laparoscopic ovarian drilling. okay, which is drilling holes in the ovaries to reduce the ovarian volume, which has been associated to the reduction and in the androgen circulation, which is the male hormone in these women. When the male hormone is reduced, the chances of spontaneous ovulation coming back has been found to be high based on the studies that are done. So there's a spectrum of management that ranges from both the lifestyle modification down to surgical intervention. Okay, but like I said, treatment is given to women based on the time at presentation and the need of that woman. So it is highly individualized.
Earlier, doctor, you talked about one of the side effects or effects of PCOS, especially long-term effects, if left untreated, could be issues with mental health. I'd like to know, what kind of support do you think we can provide for women living with PCOS, for those who have actually been diagnosed and are, already managing it, or even those who are yet to diagnose the condition and also access management options?
Yes, thank you for that. Yeah, mental health issues, especially with regards to PCOS, is a big problem in our environment. This is because, like I said, there's no awareness about this. So most women suffer in silence, die in silence. So it starts with education, awareness, and awareness creation about this disease, so that the women can understand that this disease exists, understand the symptoms and signs that are associated with the disease, and also know where to go for help. You understand? That alone can reduce most of the mobilities that are associated with this disease. Okay? So because by so doing, they will be able to get the treatment they deserve. The problems that are associated with this disease will be reduced to the barest minimum. And the other ones are, of course, training of healthcare personnel, especially those that are in mental health specialties, okay, and the management of these conditions, because these women can come with depression, they come with anxiety disorder, they come with all forms of other mental health issues, you understand, such as post-traumatic stress disorder, personality disorders, and so on and so forth. So these conditions can actually be managed, yes, because in fact, majority of them, just the psychotherapy alone, making them understand that their condition is real, making them understand that their feelings are actually shared by other people, and that there are solutions to it, can go a long way in reducing these mental health issues that are associated with these patients. So awareness creation, training of health facility, training of health personnel, provision of health facilities that are geared in the treatment, that are specific for the treatment of this condition, as well as improving hospital patronage or hospital seeking behavior among our women will go a long way in solving both the mental health issues as well as other comorbidities.
Okay, doctor, I'm very particular about the age limit for this condition. I know that it is it is for women, it mostly presents with women in their reproductive age. But I'd like to know, are there any chances that women who have perhaps approached menopause could still present with PCOS, or is there any, I just want to clear that up.
Yes. Okay. I want to remind you again that I said that PCOS has no cure. So once you have been diagnosed with PCOS, it stays with you until the person dies. So even at 90 years, a woman that has PCOS still has PCOS. But the commonest presentation, like we know, is irregular menses and inability to conceive. These are problems of women within reproductive age group, and this is usually what brings them to the hospital. However, the other long-term effects, such as obesity, hypertension, diabetes, mellitus, arteriosclerosis, coronary heart disease, can still, manifest in older age, because these are usually diseases of old age. Yes. So you may see women presenting with all these conditions, and when you evaluate them, you realize that the ovaries are actually small, and though the PCOS may not be the major problem at that time, but those long-term effects will now be manifesting and are still forms of presentation of PCOS, okay? Because at menopause, the ovaries usually atrophies. The ovaries completely dries and reduces in size and become non-functional. But because of the metabolic effect that is associated with this condition, which I told you has some genetic kind of correlation, okay, these women will still end up with so many of these long-term effects, which are indirect manifestation of PCOS, yes, and also deserve treatment. But the classical presentation usually occur within the women within reproductive age group as a result of things I mentioned.
All right. Thank you so much, Dr. Uwandu. We wish we could have more time with you, but that's the much we can take with you. Thank you so much for joining us on the program this week. Of course, early diagnosis and proactive management can mitigate these risks. Regular checkups, lifestyle modifications, and medical interventions are essential for women with PCOS. Thank you so much, Dr. Uwandu, for your time. And that concludes this week's episode of the program. But before we go, we'll leave you with some of the facts you probably didn't know about PCOS. And until next time, do well to subscribe, follow all Trust TV social media handles. I am Aisha Salihu.